Hi everyone, welcome back to my YouTube channel. Today we are going to talk about necrosis. So let's start our topic with introduction of necrosis. Necrosis is form of irreversible cell injury resulting in premature death of cells in living tissues. It occurs when cells are exposed to extreme stress or damage that surpass their ability to repair. Unlike apoptosis, that is programmed cell death, necrosis is typically associated with inflammation and pathological process. Definition of necrosis. Necrosis is defined as uncontrollable cell death due to external factors such as infections, toxins, trauma, or interrupted blood supply. It often leads to swelling, rupture of cell membranes, and inflammation of the surrounding tissues. Causes of necrosis. Several factors can lead to necrosis, including ischemia, that is, loss of blood supply. When blood flow to a tissue is cut off, it leads to oxygen and nutrient deprivation. That results in ischemic necrosis. It is common in heart attack and strokes. Second cause of necrosis is infection. Bacterial and viral infection can destroy cells directly or through toxins, leading to necrosis. For example, Clostridium perfringens in gas gangrene. Third cause is toxins and chemical. As exposure to strong chemicals like acids, alcohol, or heavy metals can directly damage cell structure. Fourth cause is trauma. As physical injuries such as burns, cuts, or crush injuries can lead to tissue death. Fourth cause is immune reaction. Autoimmune diseases or hypersensitivity reactions may cause necrosis due to immune mediated damage. Types of necrosis. They are coagulative necrosis, liqueficative necrosis, third type is gaseous necrosis, fourth type is fat necrosis, fifth type is fibrinoid necrosis, and sixth type is gangrenous necrosis. Now let's talk about these types one by one. First type of necrosis is coagulative necrosis. It is most common type. It is seen in ischemic condition like myocardial infarction. In this basic tissue architecture remains preserved for a few days. It appears faint and pale. Second type is liqueficative necrosis. It occurs in brain infarction or abscesses. Enzymatic digestion results in complete tissue liquefaction. There is sperm formation in this type of necrosis. Third type of necrosis is gaseous necrosis. In this, there is combination of coagulative and liqueficative type of necrosis. It is the characteristic of tuberculosis. It has tissue that has cheese-like appearance when there is gaseous necrosis. Fourth type is fat necrosis. It is seen in acute pancreatitis or when there is trauma to fatty tissues. Fatty acid combines with calcium to form chalky deposit that is called sponification, and that type of necrosis is called as fat necrosis. Fifth type of necrosis is fibrinoid necrosis. It occurs in immune mediated or immune related diseases. It affects blood vessels. In this, there is deposition of immune complexes and fibrins that lead to bright pink staining of vessels wall under microscope. Sixth type is gangrenous necrosis. This is clinical term, not a histological term for the necrosis. It typically affects limbs or intestine due to ischemia. It can be either dry gangrene, wet gangrene, or gas gangrene. Dry gangrene is when there is coagulative necrosis from ischemia. Wet gangrene is when there is liqueficative necrosis due to infection. And gas gangrene is when it is caused by gas producing bacteria like Clostridium species. Pathophysiology of necrosis. Necrosis involves ATP depletion that leads to energy failure. Then there is after energy failure or ATP depletion, there is membrane damage that causes loss of ionic balance. Then after the loss of ionic balance and membrane damage, it results in calcium influx that causes activation of degradative enzymes. Once the enzymes release, there is autodigestion of cellular components, and this cellular components when released outside they cause inflammation, and immune cell infiltrate are there that damage area and contribute to further tissue injury. Morphological changes. First, there is gross appearance. There is swelling, discoloration, softening, or framing of tissue depending on the type of tissue. Second morphological feature is that the tissue may appear black or green in gangrenous necrosis. Second, there are appearance or microscopic features related to necrosis. First, there is loss of nucleus that may be caused by karyolysis, pycnosis, or karyorrhexis. The nucleus or cytoplasm is eosinophilic due to protein denaturation, and there is disruption of normal cellular architecture. Clinical significance of necrosis. Necrosis is hallmark of many serious medical conditions. First, myocardial infarction or heart attack. In this, there is necrosis of heart muscle. Second, stroke, in which there is necrosis of brain tissue due to ischemia. Third is tuberculosis, that is indications necrosis in lungs. Fourth is pancreatitis, that is fat necrosis in abdominal cavity. Fifth is gangrene, that requires immediate medical or surgical intervention because it can spread. If these things left untreated, necrotic tissue may become infected and lead to sepsis. That is a life-threatening systemic condition. Diagnosis of necrosis. Diagnosis of necrosis is based on clinical history and symptoms. Second, we can also do imaging like MRI, CT, or ultrasound, especially in case of heart and brain. Third, we can also do biopsy or histopathology for the confirmation. And fourth, there are also laboratory tests that check the markers for necrosis. Treatment of necrosis. Treatment of necrosis depends on cause and extent of necrosis. First, we can remove the necrotic tissue, that is also called as debridement or surgery. Second, treatment option is antibiotic. If infection is present, antibiotics are given. Third is restoration of blood supply in ischemic cases so that the tissue remains healthy and the tissue that is not affected is not going to affect. Fourth, we can also do supportive care to manage systemic effects because of necrosis and inflammation. In some cases, amputation may be necessary in severe gangrene. Conclusion of this lecture video. Necrosis is an important pathological process that results from severe cellular injury. It plays a critical role in progression of various diseases and requires timely intervention to prevent further complications. Understanding its types, causes, and consequences is essential for medical professionals to provide appropriate care and treatment. And this was all about necrosis. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.